Hello and welcome. This is Desiree Chappell. It's Tuesday. Welcome to the Roundtable. The Roundtable is our chance to discuss hot topics in perioperative care with the experts as well as those on the front lines. Pull up a chair.
Top Med Talk.
I'm here with Monty, Mythen, Editor-in-Chief of Top Med Talk. We have Kim Duggan. She is a nurse, and she's the Surgical Home and Enhanced Recovery Manager at New Hanover Regional Medical Center in Wilmington, North Carolina.
Yes, thank you for having us.
Kim, thank you so much for sitting down. You have a friend here who's going to join in. Can you introduce?
I do. This is Robin Davis, and she is our pre-admission testing manager for our facility.
Oh, Robin.
Hey, Robin.
Hey, Robin.
Hello.
So I guess you're hearing some things, too, that are speaking to you.
Oh, yes, absolutely.
All right.
So I used to live in North Carolina. We spent quite a lot of time down in Wilmington. I was at Duke, but that was a favourite trip down to the beach and what have you, and the battleship there.
Well, wonderful. We welcome you back.
Anytime, right? Come and chat with us. That's great. Well, yeah. Well, tell us a little bit about what you're doing at New Hanover, kind of your role as the manager and what a program kind of looks like there.
Well, thank you for asking. I started the program along with Dr. Rob Shaker and our anesthesia department at New Hanover in 2016. We rolled out, of course, with colorectal, as everyone else does, because that's your biggest bang for your buck. We took what was a 5 to 10 day length of stay at our for colorectal surgery, and we put one patient through with one surgeon and one anesthesiologist just to see if applying the principles would work. And when that patient was ready to leave post-op day 2, we were just like jaw dropped. Sold. And then we did it again. And here we are, fast forward 2 years into it. We're rolling out our 15th service line. And in 2018, which I just got my numbers back, we saved $12 million.
Wow.
For our facility.
God. I want to give you a hug and a high five and everything else. That's awesome.
It is exciting. It's exciting. And just to be a part of this, just to be on the launching end of it and to see where we can take it.
Yeah, well, to be at the forefront, really, of these types of quality improvement programs here in the U.S. for sure is amazing. Tell us a little bit about your facility, because, a lot of what we hear at meetings like this, it's academics, right? All these huge academic societies, and of course there are facilities, and they're doing it well, and you hear from Monty Mythen, who's been doing it in the UK for 20 years, but what type of facility do you come from? And
we are a community hospital. We are an educational facility as far as we have a residency program, a teaching facility. We have 855 beds, and we're actually the only hospital in 7 counties. So we're a Trauma 2 center. Everything that comes from the rural outerlying counties comes to us for emergency surgeries, urgent emergent. But we are the only large institution for that area.
Yeah, so this can be done in a community hospital.
Yes, it absolutely can be done, and it can be done well.
Yeah. And quickly.
And quickly,
because
yes.
I was just checking, because I remember when I was down there giving a talk, and I think that's when I met Rob. It was, I'm looking at the pictures on my phone, it was October the 15th, 2015.
Yes.
And I think you were just warming up then.
2015 is when we rolled out our orthopedic line for our total joints. So we did knees and hips, and we have now expanded that into shoulders as well. And then 2016 we rolled out colorectal, and then quickly following that was cardiac, spine fusion, gynecology, oncology, which now has expanded to hysterectomies, hepatobiliary, and here we are. We're rolling out this month alone. Matter of fact, Monday, I'm rolling out our maternal line for C-sections, abdominal wall reconstruction, and our breast line.
We need you in Dallas.
We do need you at the EdPom meeting, my gosh.
Well, I will be happy to, yes.
Yeah, I love it.
Because it's any where it didn't work, any cautionary notes,
or maybe more challenging than other.
I would have to say The greatest challenge has been our spine fusion line. Not just because we're trying to get more of a footing. We want to make sure that we're being able to help these patients with their pain management, and when they have such high levels of opiate consumption chronic pain management, that in itself is a challenge. But we've got some good practices in play that we think are really beneficial.
Oh, that's cool.
And I know you got to catch a plane.
I know. And Robin's sitting over here looking, and she's like, "Okay, time to go."
So we really do want to get to Dallas in March for our EPOM meeting. 6 minutes. You can do a lot in 6 minutes. Have you done anything about emergency yet? Have you
emergency laboratory.
Or fracture neck of femur, or
we actually do have a hip fracture program that is not under my umbrella, but we are looking at that, and I do want to expand upon that.
Do you have a visitors program at all? Can people swing by and?
We do. We host site visits frequently. Matter of fact, I just had a group from Washington State there last week, and we've hosted New Jersey. I have Kettering, Ohio coming the end of this month.
Sweet.
So we are always. It's such a wonderful program that we think everyone needs to be doing.
Absolutely, and they don't have to reinvent the wheel. If someone's doing it, we can learn off others.
Right.
Yeah. I've got 2 questions. The second question is going to be, if I gave you a billboard, what would you put on it? Okay,
so think about that
for a second. But the first question is takeaways from this meeting. What are the big takeaways that you had from this meeting?
It helps to validate everything that we're doing right now, as well as where we need to go and what we need to focus on. And frailty is our big thing this year. Yeah. When I came last year, and I went home and told the nurses, within the next year, we're going to be starting the frailty scoring. And this year, we really are going to be doing it. So be prepared for that when I come back, folks.
Love it.
What did you make of the exercise testing stuff? Did that make any sense?
No pressure to say that you love it.
The reason I say that is just up the road is one of the first places in the USA to be doing it now, which would be interesting.
I don't know that I'm 100% bought into that just yet. The intensive exercise testing that you're talking about, I'm not 100% sure I'm there yet.
Excellent.
That's a good point.
What are your big takeaways from the meeting? And then I'll give you a billboard.
My big takeaways. There were 5 things that I would like to put into our currently running programs. One of them is for our maternal line. Some things I cherry-picked out were to give away goodie bags and have them filled with everything that the patient needs, the carb-loading drink, the abdominal binders, just so many different things that we can add into our programs just to elevate it. I like the frailty. I want to do preconditioning for our cardiac, our open heart line. Mm-hmm. I want to do that. Trying to get my surgeons to buy into that might be a little bit of a challenge because our folks are really sick down in southeastern North Carolina, and we want to. I don't know if we have the time availability to be able to get them optimized.
It's a big, but it's
so is ERAS.
Indeed.
So if you can do that, you can do anything.
Get the frailty checked off. What do you want on your billboard?
I want it to say change is good. The old way of doing surgery is gone, and we need to embrace the enhanced recovery program.
I love it.
Do you want a billboard?
No, I do not. Thank you.
I need to catch a plane.
Yeah, there we go.
I got to get an Uber or a Lyft or something.
Ladies, I cannot even tell you. Thank you so much for sitting down with us. It's been great. Hopefully we can catch up soon and learn more about your all's program.
My pleasure. Thank you so much
for listening. Cheers.
Top Med Talk.
Nick Majerison here. Thanks for listening to Top Med Talk. Now all you need to do is find us on social media. We can be friends on Facebook. We can follow each other on Twitter. We can hang out on Instagram. Or we can even gorp at each other on YouTube. Get onto your social media platform, whichever your favourite is, and you're likely to find Top Med Talk there. Whilst you're at it, make sure you've subscribed to this podcast so you never ever miss an episode. Helps us enormously if you do that, by the way. And check out the website, topmedtalk.com. On there you can find the email updates where we update you as to what we're doing each week. And whilst you're online, whilst you're doing your thing on the internet, I highly recommend you download all of the podcasts that we've put out here on Top Med Talk. We do an enormous amount of material here. A lot of it is incredibly valuable and, of course, will be in the future. So I just recommend you download the entire back catalogue if you could. Helps us out if you do that as well. And check out edpom.org/meetings, because if you go on there, you can find out where we're recording and what we're doing, because we go to the big meetings, the EdPom meetings. You may have noticed most of our material comes from some of these wonderful conferences that are organised by evidence-based perioperative medicine. So EdPom, ebpom.org/meetings. Get yourself on there, and why not check out the Dallas Masters course, a perioperative care practicum. Hopefully I'll see you there.